Well, hello everyone. Here to talk about one of your favorite topics, physics. And hopefully this physics will help you understand a little bit more about what's happening in terms of the electricity that's involved with electroconvulsive therapy. So electricity is simply the flow of charged ions or electrons. The electricity that comes out of the wall in most homes is a sine wave, as you can see right here in this diagram. This is the waveform of electricity that was used traditionally in ECT. However, there have been advances which include this square wave, as you can see down here. The advantages of square wave stimulation include a lesser amount of electrons or charge. Studies show that square wave administration is just as effective as sine wave, but helps to cut down on the cognitive side effects that can be very common with ECT. Most modern ECT machines generate a biphasic waveform, as you can see right here, so above and below this x-axis. So in reality, this doubles the frequency, and that's something important to keep in mind when you're actually doing calculations. And as you can see, these are just a series of boxes, and these various parameters add up to give us our total amount of energy or charge that we are giving to the patient. So we have the height of the box, which is the amplitude measured in milliamps. We have the pulse width. We have the total duration of how long the stimulus is going. And then, of course, we have the frequency. And it's important with the frequency, again, we're doubling it because there's one box that goes up and one box that goes down. In terms of pulse width, there are several different durations here. So shortening the pulse can help reduce the cognitive side effects associated with ECT. There are two randomized controlled trials that compared ultra-brief. Ultra-brief is going to be anything less than 0.5 milliseconds, and brief pulse. And the use of an ultra-brief stimulus markedly reduces adverse cognitive side effects, and when coupled with markedly suprathreshold rate unilateral treatment, also preserves efficacy. So for any of you who work with me, I tend to do a lot of ultra-brief pulse. The reason being, trying to help cut down on that retrograde and anterograde amnesia as much as possible. And that is why we use square wave.